You've asked for it, and here we are. Together we're going to explore whether microneedling actually helps to stimulate new hair growth. We're going to talk about the pros and cons of professional versus at-home treatments. I want to make sure that you're informed because if you're considering incorporating microneedling into your routine, you should know what the best approach is. Stay to the end because I have a step-by-step guide in terms of how to incorporate at-home microneedling into your routine. Microneedling is also known as collagen induction therapy, and in my opinion, this is a minimally invasive technique where we use multiple fine needles to create a controlled microtrauma to the scalp, specifically in the epidermis as well as the dermis. And the whole idea is to get our own body involved in helping in the repair process. Now, this has been used since the 1990s to address acne scars, wrinkles, melasma, hyperpigmentation, and now it's being used to stimulate new hair growth. There's a lot of research to support that using microneedling for androgenetic alopecia, alopecia areata, or telogen effluvium is very effective, and sometimes it's even more effective to use microneedling in conjunction with other medical modalities. So we're going to discuss those together. So how does microneedling work to stimulate new hair growth? Well, when we cause this microinjury to the scalp, you're activating the wound healing process, and it's broken down into 3 stages. Inflammation is stage 1. This is where our own body releases all different sorts of growth factors and inflammatory cytokines. It says, come to the site of injury. It's during the 2nd stage called proliferation where we get fibroblasts and elastin and collagen, as well as the formation of new blood vessels called angiogenesis. And of course, this is also when we get activation of the dermopapillae. This is where the stem cells are located in the hair follicles, and this is critical for new hair follicle formation. And then finally, we get to the stage 3, which is tissue remodeling. This is when the collagen and elastin mature, they improve the structure of the scalp, and that is critical for supporting the hair follicles and preventing unnecessary hair shedding. We know in fact that microneedling does work because we've done studies on mice. I also have many patients who've used microneedling devices and who have seen really great results. It's important to point out that the goal with microneedling is to stimulate the increase in the hair shaft thickness. That means if you use a microneedling device in an area where there's no hair follicles, it's not going to stimulate new hair. It's only in the areas where you're having thinning, the areas where you have what are called vellus hairs. These are little baby hairs that if you don't try to stimulate them, either with medication or of course with microneedling, they're going to be gone. So the goal with microneedling is to get those vellus hairs to become thick again. Now there are really 4 different ways that microneedling can be performed. First is with individual needles, and this is usually performed by a healthcare provider. They use titanium or stainless steel needles. They create multiple injections across the scalp. We use this approach because it's very effective for delivering PRP as well as mesotherapy. There's also the option of using a micro stamp. This would be a device like a Morpheus or a Virtue machine. And then of course, derma rollers, very popular to be used at home or in an office environment. However, it can cause unnecessary cutting of hair follicles. And then the last option is a dermapen. Similar concept to a micro stamping device. And again, this device is used in an office and sometimes also at home. There is a big range in the length of needles used for microneedling. 0.3 millimeters to 2.5 millimeters. The needles that you can purchase online will be anywhere from 0.3 to 1 millimeter. But I do want to warn you, the FDA has never approved an at-home microneedling device. And in the office, we usually use needles that range from 1 millimeter to 1.5 millimeters. And the reason for that is because that depth is where the dermapapilla are located. The goal with the needle is to get down to the stem cell area so that new hair follicles can be generated. With that said, using a smaller needle will still be beneficial because it will stimulate growth factors, but it might not be as effective as doing this procedure in an office. Now, the other thing that you should be aware of, if you are someone who has hair loss, our scalp gets thinner, okay? It actually gets thinner. So as a result, the needle length should be shorter. You don't want to have really long needles as a result of that. And the other issue is that when you're performing microneedling at home, if you over microneedle, you can cause scarring, and scarring leads to hair loss. So you have to be very, very cautious. if you're thinking about doing microneedling at home, I would say start with a really small needle, anywhere from 0.3 millimeters to 0.5 millimeters, and only microneedle every other week or once a month just to start. I would not be doing this on a daily basis because you will cause a lot of irritation to the scalp and you can actually cause hair loss if you over microneedle. We know that microneedling as a monotherapy is very effective to stimulate new hair growth, but when you combine it with other medical treatment options, it's even more effective. So if you use PRP and you're introducing more growth factors into an area that's already being stimulated to generate its own growth factors, that's very effective. Mesotherapy, where you're introducing medication, either dutasteride, finasteride, or minoxidil into the scalp, into those micropores, is another very beneficial treatment to do in combination with microneedling. And then if you're doing microneedling and you want to use topical minoxidil, specifically Rogaine, that can be even more effective to see better results with hair stimulation. The only thing I will preface is that if you're using Rogaine, I would use topical foam, not the liquid form, because it could be more irritating to the scalp, and I would wait till the next day to apply it. Additionally, if you're taking oral hair loss medications, that will also help in combination with doing microneedling. If you're going to have microneedling performed, it's critical that you wash your scalp beforehand. And that's whether you're going for an in-person procedure or you're going to perform this at home. For in-person procedures, we like to apply lidocaine cream or we perform a ring block so your entire scalp is anesthetized when we do the microneedling. If you're performing this at home, it's very, very important that you clean your device before and afterwards, and I would recommend using alcohol. The last thing you want to do is introduce bacteria that can cause an infection when you're performing the microneedling. And as I emphasized before, less is more in the beginning. Use a smaller needle and don't use the microneedling device as frequently. You can absolutely wash your hair after you perform microneedling, and if you have any pain or discomfort afterwards, you can use a Tylenol or a Motrin. And finally, we get to risk factors. And though I think microneedling is a very safe procedure to perform to stimulate hair growth, there's a few things to keep in mind. When you microneedle, it's possible that you're going to get erythema, redness of your scalp. You'll get some blood dots because you're causing some micro trauma. It's also possible you might develop some itching after you do microneedling. Now, I have seen patients develop swelling after microneedling the next day, so don't be alarmed if that happens. The swelling usually subsides within a couple of days. Sometimes you need a steroid metrodose pack to lower the inflammation. And again, you have to wash your device. Don't want to introduce any bacteria that can lead to an infection. Now, I also have to warn you that some patients develop hair shedding when they microneedle. This does not mean you're losing your hair. Those hair follicles that are falling out will absolutely regrow. And then I also want to recommend that you stop any retinoids or acidic products that you're applying to your hair a week before because it can be very irritating to the scalp. My goal as a hair surgeon is to make sure that you're informed so you know what are the best options to stimulate hair growth. I think this topic of microneedling is very important. If I have not addressed your questions, please leave them in the comments below. Please hit that subscribe button so you can join our community. And as always, I'm here on your journey to help you maintain your hair.